If you suffer from acid reflux or heartburn in any level of severity, I truly recommend that you watch the video Jeff had shared with me. Click the link below the description to watch the video. Heartburn, acid reflux, causes, treatment. Causes heartburn is caused by stomach acid traveling back up your esophagus, acid reflux. The esophagus is the tube that carries food from your mouth to your stomach. It has a circular band of muscle, the esophageal sphincter, at its lower end where the esophagus opens to the stomach. The sphincter closes after food has entered the stomach to prevent the contents of the stomach traveling back up the esophagus. However, if the sphincter becomes weak and does not close fully, or relaxes at the wrong moment, stomach acid can flow back up the esophagus and irritate the lining of the esophagus. Some types of food aggravate heartburn, including alcohol, which relaxes the esophageal sphincter. Coffee and chocolate, orange juice and other acidic juices. Acidic foods, such as tomatoes, oranges, and grapefruits. Fatty or fried foods. Black pepper, mustard, and spicy foods. Large meals or portion sizes. Foods that can cause heartburn vary for different people. A weekly food journal may be useful in identifying what types of food trigger your heartburn. By keeping a daily record of what you eat, the time that you eat, and any activities that made your symptoms worse, you should be able to correlate specific foods with episodes of heartburn. Other factors that can cause or make heartburn worse include being overweight, smoking, stress and anxiety, use of non-steroidal anti-inflammatory drugs, NSAIDs, and pregnancy. Heartburn is common in pregnancy because the esophageal sphincter is weakened during pregnancy and the pregnancy places increasing pressure on the stomach, all of which promote the reflux of acid from the stomach. Heartburn associated with pregnancy usually resolves after delivery of the baby. Signs and symptoms of burning pain in the chest, which usually occurs after eating and sometimes at night, is the most obvious symptom of heartburn. This may be accompanied by a sour taste in the back of the throat and/or a feeling of food being stuck in the throat. The symptoms are often worse when lying down or bending over. Other signs might include a cough, hiccups, and/or a hoarse voice. Diagnosis. Taking your medical history and a physical examination is often all that your doctor requires to make a diagnosis of heartburn. To determine how severe your heartburn is or to determine if there is any damage to your esophagus, your doctor may conduct tests. These tests may include endoscopy, which involves using an endoscope, a thin flexible tube with a camera and light at one end, to examine the lining of your esophagus, or pH monitoring, which involves using an acid monitor, a thin tube or catheter with a sensor at one end, to measure acidity levels in your esophagus. Treatment. Treating heartburn is important because over time acid reflux can damage your esophagus. Many over-the-counter and prescription medications are available to relieve the symptoms of heartburn. They can be grouped into three major categories. Medications that neutralize stomach acids, known as antacids. These medications provide quick relief by reducing the amount of stomach acid but do not help to heal existing damage to your esophagus or prevent future episodes of heartburn. Antacid brands include Mylanta, Eno, Quick Ease and Gaviscon. Medications that reduce the production of stomach acid, known as H2 receptor blockers, e.g. ranitidine and cimetidine. These drugs are slower acting than antacids but provide longer-term symptom relief. Medications that block stomach acid production and help to heal the esophagus, known as proton pump inhibitors, e.g. omeprazole and lansoprazole. These drugs block the production of acid in the stomach, allowing time for the damaged esophagus to heal. Surgery that aims to strengthen the esophageal sphincter may be an option if lifestyle changes and medications have not helped. Prevention. The following lifestyle changes can help you to avoid heartburn. Lose weight. Maintain a healthy weight. Excess weight places pressure on the stomach, causing stomach acid to back up into the esophagus. Quit smoking. Smoking impairs the normal functioning of the esophageal sphincter. Diet control. Avoid foods that trigger your heartburn and reduce the amount of food you eat. Avoid lying down after a meal. Wait at least 3 hours after eating before lying down or going to bed. Raise the head of your bed by placing blocks under the feet at the head of your bed, or insert a wedge between your mattress and the bed's base so that your body is elevated from the waist up. If you suffer from acid reflux or heartburn in any level of severity, I truly recommend that you watch the video Jeff had shared with me. Click the link below the description to watch the video.